Dr. Jaffe, can you explain how one can use food provocation as recommended by you to gauge immune tolerance?
Well, this is really a venerable technique that goes back many decades. You basically have one food three times during 1 week. So on 3 consecutive days, you consume that food, and then for the rest of the week, you follow your sensitivities, reactivities, your feelings, your functions, and very often you will be able to detect a food sensitivity. And you should avoid that food for at least 3 months. So we can use the body for a biotolerance investigation. This is metabolomics. This is um, your predictive value of your knowledge about yourself as you test one food a week, consuming it three times, and then following your symptoms for the next week. Yes, it does take days, not hours, not months, but days to observe the consequences, the effects of consuming a food. So it takes a few weeks to do this, but it's very interesting. And people who have done it very often have learned a great deal about themselves, their metabolism, what they can easily digest, assimilate, and eliminate without immune burden, and what they should substitute for some months to avoid provoking the immune defense and repair system. So, food provocation, a venerable technique that we now feel is time to resurrect and to make use of as a self-test to find out what your food chemical sensitivities seem to be. Of course, we want to avoid processed and ultra-processed foods. We want to avoid plastic and GMO glyphosate. We want to avoid the toxins of the 21st century while eating a diet that is sufficient to all the nutrients we need, plus the supplements that we must take in the 21st century. So food provocation, a valuable technique. We can show you how to do it using nature's pharmacy principles.